AESKUCARE Gluten-Related Disorders IgA, a convenient point-of-care immunoassay for qualitative and quantitative measurement of specific IgA antibodies against antigens involved in gluten-related disorders. With results in just 30 minutes using 1 drop of blood, it's perfect for healthcare professionals to make nutritional recommendations and to support diagnosis of gluten-related disorders. Quantitative measurements require a separately available reader, while qualitative assessment is possible visually. Adjust all reagents and the assay device to room temperature for 30 minutes. Write patient ID, wash hands, wear gloves, and optimize blood flow by massaging fingertips or using warm water. Clean the pricking site with the provided alcohol wipe. The test itself involves 6 steps. First, prick the fingertip using a safety lancet and collect 20 microliters of blood using the provided capillary pipette. Second, transfer the blood into the sample diluter vial, close it, and mix gently for 2 seconds. Using the syringe, inject the entire content into the device. Avoid air bubbles. Incubate for 8 minutes. Third, inject the first washing solution, then the primary antibody solution into the device and incubate for 8 minutes. Fourth, inject the second washing solution and secondary antibody vials into the device. Incubate for 8 minutes. Fifth, inject the third washing solution into the device. Open the 2-color reagent vials and inject the solution of the first vial. Start the timer for 5 minutes and directly inject the solution into the second vial within 30 seconds. Finally, inject the stop buffer into the device. You're done. Check the test results using the evaluation sheet. Test row 1 functions as a control. If no IgA signals appear or the intensity of IgA signals is less than the cutoff, stop the evaluation. If the intensity of the IgA signals is approximately the same or greater as the cutoff, proceed with the test. If the cutoff calibrator or the function control is missing, or the negative control is greater than cutoff, the result for the whole test device is invalid. For visual evaluation, compare the signal intensity of the individual antigens with the cutoff calibrator to estimate the result. If the antigen signal is less than the cutoff, the test result is negative. If the signal intensity is approximately the same as the cutoff, the result is equivocal. When the signal intensity is greater than the cutoff, your test result is positive. In this case, and for further information, consulting a physician is recommended. Screen your patients easily for gluten-related disorders during a consultation with AESKUCARE Gluten-Related Disorders.